Greetings of peace. Assalamu alaikum warahmatullahi ta'ala wa barakatuhu. So today we will continue our discussion for psychiatric nursing or mental health nursing with the unit 2, which talks about the review on assessment of nervous system. So I know that you know how to properly assess your neurological system. Okay, however, I would like to have a review on the specific assessment that we'll be having if we are to meet a patient with psychiatric disorders, okay, or people who have problems with their cognitive or with their emotions and feelings and their ability to cope up with the things that surrounds them. Okay, so the nervous system is one of the most important systems in the body because it controls and coordinates all body activities. So we all know that the brain is the mastermind of all processes in the body. So they are the one who controls everything except for the heart, okay? Because heart contracts on their own, okay? So it allows us to respond to stimuli, to think, to move, and maintain internal balance. Now, your nervous system, okay, has three major functions. It receives sensory information, processes it, and responds through motor output. So first is the sensory information or sensory input. This is the ability to detect any changes from our both inside and outside of the body, or the external and internal environment. The second function is integration. This is where, or the process, okay? This is where the brain processes and interprets the information received. And the major function, the last major function of the nervous system is the response or the motor output. This is the response such as muscle movement or gland secretion. For example, when you touch a hot object, your sensory receptors detect heat. Now, once na-detect yung heat, the brain interprets it as a danger, and your muscle quickly withdraws your hand, and that is your motor response. So again, the three major functions of your nervous system include your sensory input, your integration, and your motor output. Okay, so again, these are the main functions. Now, the division of your nervous system is two, okay ha? So namely, the central nervous system and your peripheral nervous system. So the central nervous system includes your brain and your spinal cord, which is responsible for processing and interpreting information. So the CNS is also known to be the control center because they are the one who process the information. While your peripheral nervous system consists of nerves outside the CNS. Now, the CNS, again, it includes the brain and the spinal cords. Now, the brain has three major parts, namely your cerebrum, okay, your cerebellum, and your brainstem. So these are the three major parts of the brain. However, I know that there are different parts of the brain, including your hypothalamus, thalamus, medulla oblongata. Okay, these are all parts. However, I want to discuss or review the specific or major parts of the brain. Okay, your cerebrum is the largest part of the brain. Okay, which functions includes thinking, memory, voluntary movement, and sensory interpretation. Now again, cerebrum is responsible for thinking, for memory, and voluntary movement. For example, solving a math problem, okay, understanding a scientific process. So these are part of the function of your cerebrum. While your cerebellum coordinates, okay, or controls movement and coordination. So again, coordinates voluntary movement and balance, and also it helps maintain posture and muscle tone. So example, how we run, how we walk steadily is a function of your cerebellum. Now, your brainstem okay, controls the vital functions such as your breathing and your heart rate. So, and also your blood pressure. It includes, your brainstem includes the midbrain, the pons, and the medulla. So this different parts of the brainstem has specific different functions, okay, or responsibility in controlling the vital life functions, okay? So your spinal cord is the one, okay, or acts as a pathway between the brain and the body. So it also controls, okay, your reflex actions. So it transmits nerve impulses between the brain and the body and responsible for reflex actions. So for example, quickly pulling your hand from a sharp object without thinking, because that's a reflex action, okay? The body knows that that is a danger, okay? So one of the reflex action is we withdraw from pain, okay? Now, for your peripheral nervous system, again, we have already mentioned that peripheral nervous system consists of the nerves outside the CNS. So this includes the spinal nerves, the peripheral nerves, okay? So from the word peripheral, it is away from the central body, okay? Now, it connects the brain and the spinal cord to the rest of the body, okay? Now, the PNS or peripheral nervous system has two divisions, namely your somatic nervous system and your autonomic nervous system. Now, your somatic nervous system controls voluntary actions, or it is its responsibility is for voluntary control. Example, raising your hand, running, okay, controlling your breath underwater. These are example of your voluntary actions. Now, for your autonomic nervous system, it controls the involuntary functions such as heart rate, the blood pressure. So now, the autonomic nervous system, sorry, has two divisions, namely the sympathetic and the parasympathetic. So your sympathetic is known to be the one controlling the fight or flight response, while your parasympathetic is responsible for your rest and digest response. Now, your sympathetic, again known as the fight or flight system, increases heart rate, dilates pupils, and prepares body for stress. So, okay, so your parasympathetic, however, known to be the rest and digest system. So opposite they have opposite effects on the body. The parasympathetic calms the body, okay? So it sorry. Example, digesting after eating. So while sympathetic is more on activating or preparing us to respond to a stress, the parasympathetic happens if after you responded to that stress, you need to calm down your body. So the parasympathetic nervous system is responsible for that, for calming your body after responding to a stress. Okay. Now, let's talk about nerve impulses and neurotransmission. Now, communication is very important in the nervous system because it transmits information. How can we provide a motor output if there will be no sensory output and the ability to process it? No, that's why it's very important. So, how does communication in the nervous system happens? It happens through electrical and chemical signals. Okay. Now, chemical signals are transmitted through transmitted across synapses, while your electrical signals travels through your neurons. Again, your neurons are the basic functional unit of your nervous system. Okay. Now, neurotransmitter are known to be your chemical messengers that carries signals between neurons. So they can be excitatory, which stimulates an action, or they can be inhibitory, which reduces activity. Now, these neurons communicate information with one another by sending electrochemical messages from neuron to a neuron. It is a process called your neurotransmission. Now, in the nervous system, the electrochemical messages cross the synapses between your neural cells by way of special chemical messengers called the neurotransmitters. Now, neurotransmitters are the chemical substances manufactured in the neuron that aids in the transmission of information throughout the body. So again, they either excite the body or they either inhibit or stop an action. Now, they are necessary in just the right proportions to relay messages across synapses. So again, we mentioned that the what they call this, communication happens in the nervous system, okay? And it is through electrical and chemical signals. Now, how can we send chemical messages or signals from a neuron to another neuron? It is through your neurotransmission. It is through your neurotransmitters, okay? So your neurotransmitters, you just remember, okay, in order to understand and not to forget the neurotransmitters found in the nervous system, is your DANGs or DA and GS. So mnemonic causes, DANGs causes SAMAN. Okay, this mnemonic helps student nurses remember the major neurotransmitters involved in mental health and psychiatric disorders. So DANGs means D for dopamine, A for acetylcholine, N for norepinephrine, G for GABA or your gamma aminobutyric acid, and your S for your serotonin. Now, let's talk about first the dopamine. So dopamine is a neurotransmitter involved in the control of movement, your motivation, cognition, and emotional responses. So the functions of dopamine includes regulates voluntary movement, influences pleasure, reward, and motivation, plays a role in thinking and cognition, and it helps regulate emotional responses. So an imbalance of this neurotransmitter is linked to schizophrenia or Parkinson's disease. So that is dopamine. Now, the next one is your acetylcholine or ACH. It is a neurotransmitter found primarily in the neuromuscular junction. So from the word neuromuscular junction, it is the connection between your brain, okay, or the nervous system and your muscles, okay, where it stimulates muscle contraction. So the function of acetylcholine controls skeletal muscle movement, involved in learning and memory, and also it regulates sleep-wake cycle. Now, this is and any imbalance of this acetylcholine is usually linked in Alzheimer's disease, myasthenia gravis. So for intellectual problem or mental health problem, okay, or cognition problem, it is more on incline in Alzheimer's disease. So next we have here your norepinephrine and epinephrine, no? So these two are neurotransmitters involved in body stress response and regulation of attention, mood, and arousal. So it functions may include regulate alertness and attention, influence learning and memory, controls sleep and wakefulness, and plays a role in mood regulation. So, low levels of norepinephrine is usually linked to depression. Okay? So, the next one is your GABA or your gamma aminobutyric acid. So, GABA is the major inhibitory neurotransmitters in the brain. Okay, so this is one of the major inhibitory, which means it stops action. Okay, so the function includes reduces neural activity, produces calming and relaxation. It helps regulate anxiety and stress response. Because it slows down nerve impulses, the GABA reduces overstimulation in the brain. So, low levels of this neurotransmitter is linked to anxiety disorders. Okay? And then, the last one is your serotonin. Okay? It is a neurotransmitter derived from your tryptophan. So, which is your tryptophan is an essential amino acid obtained from the diet. So, the functions of serotonins, first, it plays an important role in regulating the mood, the sleep, appetite, pain perception, body temperature, sexual behavior, and emotional regulation. So these are just some of the functions of your serotonin. Now, low levels of serotonin is linked to having depression. So these neurotransmitters, again, your dopamine, your acetylcholine, your norepinephrine and epinephrine, your GABA or aminobutyric acid, and your serotonin are very important in psychiatric nursing because any imbalances with these neurotransmitters are linked to development of different mental health or psychiatric disorders. Okay? So again, these are the this is a table that shows the major functions and what happens or what is the linked disorder if it's increased levels or decreased level. So for dopamine, again, if it's increased, it is usually linked with schizophrenia and mania. And then for decreased levels, it is Parkinson's disease. Acetylcholine, there's no study or there's not any disorders believed that may cause, because this linked with increased levels. Usually, pag decrease or there is a low level of acetylcholine, it is usually caused by, or it may cause Alzheimer's disease. For norepinephrine, if it's increased, anxiety or mania, and if it's decreased, it may link to or causes depression. For GABA, so for increased, nothing. For decreased, anxiety disorder. For your serotonin, if it's increased, in some cases, it causes psychosis. And for decreased levels, depression. Okay? So now let's talk about mental status examination. Now, MSE or mental status examination is a structured way of assessing a patient's mental condition. Again, it is a structured method used by psychiatric nurses and other mental health professionals to assess and describe patients' current mental functioning. It is a systemic observation and assessment of a patient's behavior or cognitive function or thinking and emotional state during an interview. So it provides a snapshot of patient's mental condition at a specific time, similar to how a physical assessment provides information about the body. However, this type of assessment focuses only on mental functioning. Now, what are the components of your MSE? So this includes appearance, behavior, attitude, speech, mood and affect, thought process, thought content, perception, cognition, insight, and judgment. Okay, so let's break down this different components of your MSE. The first one is appearance. This refers to the physical condition and outward presentation of a patient observed during the interview. So we observe here the grooming, the hygiene, the clothing, the posture and body build of the patient, the facial expression, their eye contact, and physical characteristics. So example, a clean or well-dressed patient or a disheveled or poor hygiene patient. Okay, so that's generally it's an observation. Now, so again, normal findings: appears clean, well-groomed, dressed appropriately for the weather, and maintains good eye contact. So a patient, abnormal findings may include a disheveled, poorly groomed, wearing dirty clothes, avoids eye contact. So, a clinical example, a patient with severe depression may appear unkempt and slouched, while those with mania may wear excessively bright or inappropriate clothing. Now, for your behavior, it refers to how the patient moves, acts, and interacts with the environment. So what are the things that you need to observe for your behavior? First, we have your level of activity, their motor behavior, their gestures, or any Signs of agitation or retardation. Agitation means the pacing, okay? And your retardation is slow movement, okay? So examples, again, for normal findings, the patient sit calmly and responds appropriately during the interview. First, patient who has psychomotor agitation, they paces around the room, wrings the hands, and cannot remain seated. For psychomotor retardation, they even move, the patient may move slowly, speak slowly, and appears fatigued. So clinical example, a patient experiencing anxiety may constantly fidget or tap their feet. Now, for your attitude, this describe how the patient relates to the interviewer or nurse. So common attitudes may include cooperative, friendly, if they are guarded, suspicious, hostile, or apathetic. Okay? So, if the patient answers question openly, then meaning they are cooperative. Now, if the patient gives short answers and appears reluctant to share information, they are guarded. So, for a patient who refuses to cooperate and responds aggressively, that means the patient is hostile or has an attitude of hostility. Okay? Now, for speech. So, speech assessment focused on the characteristics of verbal communication. We either assess the rate, okay, it's either low or rapid, talking or speaking, volume if it's loud or soft, the tone, the fluency, and the amount of speech. So, for example, normal speech is a clear, coherent, moderate, and rate. For rapid speech, so to people or patients who talks very quickly without pauses is common in manic or mania. Okay? Now, for slow speeches or patient answers slowly with long pauses, it's more common in depression. So, for pressured speech, patient speaks rapidly and cannot be interrupted. Now, for your mood and affect, when we say mood, it refers to the patient's subjective emotional state, usually described in the patient's own words. So, if mood, okay, I feel happy, I'm very sad, okay, I am angry. So, usually, if we talk about mood, it is the patient's expression, okay? Subjective expression of their feelings. So, example, happy, sad, anxious, depressed, irritable, or euphoric. Now, for affect, this refers to the observable emotional expression displayed by the patient. So, types of affect may include flat, appropriate, blunted, restricted, or labile. Okay. So, for affect, when we say appropriate affect, the patient smile while talking positive experience. So, for flat affect, they show almost no emotional expression. For labile, the patient's emotion change rapidly from laughter to crying. Okay. So, another components of your MSE is the thought process. So, from the word thought, meaning thinking, okay? It describes how ideas are organized and expressed. So, normal thought process is logical, coherent, and goal-directed. So, it answers the questions what the patient thinks about, okay? How the patient thinks, okay? So, abnormal thought process may include flight of ideas. This means a rapid shifting between topics. So, patient jumps from discussing work and then family and then politics quickly. So, we have also another abnormal thought process, the loose associations. Ideas shift with no logical connection. And we have also tangential thinking. The patient never returns to the original question. So, they're not capable of answering the question and they jump to another idea that is out of the context. Okay? Now, for your thought content, it talks about what the patient thinks about. Okay? So, content, thought content refers to what the patient is actually thinking about. So, we assess here for any delusions, obsessions, phobias, suicidal ideation, or homicidal ideation. So, for example, delusion is the false beliefs not based on reality. Okay, for example, the patient states the television is sending me a secret message. Now, for suicidal ideation, the patient expresses thoughts about self-harm. So, example, sometimes I think everyone would be better without me. Okay. Now, for your perception, this refers to how a person interprets sensory information or how they interpret reality. Okay? So, disturbances may include hallucination. Hallucination is different from delusion. Delusion is um, out of reality. Okay. Now, hallucination, they perceive something without a real external stimulus. Okay. So, this is about sensory or perception stimulation. They can either hear something, they can see, they can feel, they can taste something, they can sense something that has no real stimulus. So, example, it may be a auditory, which means they can hear, okay, voice, that there is no any real external stimulus. Visual, it's either they can see, tactile, touch, and olfactory, taste. Smell. So, example, I hear voices calling my name and no one is around. So, that is a hallucination. Now, delusion may include, I am so powerful, I am the genie. That is a delusion. There is no real context about or reality. It is out of reality. Okay? Now, another is your illusion. It is a misinterpretation of external stimulus. While hallucination is the interpretation or the interpretation of something that is not a real external or that has no real external stimulus. Here, for illusion, there is a real external stimulus. However, it is misinterpreted. Example, a patient sees sees a shadow and believes it is a person. Or a person or a patient sees a hanging clothes and think it's a ghost. Okay, so these are just some of illusions. Okay, or something, a person who sees a black person or a white person and then they will think that they are ghosts. Okay, or gonna do something like that, anything. Okay, or an animal that there's an animal, however, she thinks that it will transform into a human and then like this, like that. So these are just example of illusions. Again, the difference between the two, hallucinations has no external or real external stimulus. While your illusions, it has real external stimulus, however, it is misinterpreted by the mind of those or of that person. Okay? Now, for your cognition. Cognition refers to patient's intellectual function or the ability to think of a person. It is a assessment of orientation, memory, attention, and concentration. When we talk about orientation, it is the awareness of a person on time, person, place, and person, again, awareness of person, place, and time. Memory is evaluated in three levels. So, immediate, what happens recent, what happens hours before the interview. So, that's an immediate memory. While as your recent, what happened last day or last week. While your long-term memory is, it covers the ability to recall memory from the past year, okay, or example, what did you do last during your last birthday, so like that. So that is the three levels of memory that is usually assessed. Okay, and for your attention and concentration, it is the ability to focus on tasks. So usually we give tasks or mathematical problems to our patient, okay, and then ask them to answer questions. So their ability to concentrate on the problem, the ability to answer to the problem is the assessment of your attention and concentration. Now, for your insight, the last component of your MSE, the insight and judgment, insight refers to the patient's awareness and understanding of their mental condition, while your judgment assesses the patient's ability to make a reasonable decisions in everyday situation. Okay? So example, a patient is refusing treatment may have poor insight because she's not totally aware of their condition, like that. That's insight. Again, judgment is the decision-making ability of a person. Okay. So, this is an example of how nurses, as you can see here in the video, this is as an example of how nurses document findings after doing a MSE documentation. So for the appearance, patient appears poorly groomed and disheveled. Behavior, cooperative but restless. Speech, slow and soft. Mood, reports feeling depressed. Affect, blunted. Thought process, logical but slowed. Thought content, no delusions, denies suicidal ideation. Perception, no hallucinations reported. Cognition, oriented to person, place, but confused about date. And then insight, limited, judgment, fair. But you can document this in a narrative way in which you describe it all by not but by not using the bullet type. Example, patient appears poorly groomed and disheveled. He is cooperative but restless, and he speaks in a slow and soft manner. He or she reported feeling depressed. Patient appears blunted, and they think logically but slow. There is no reported delusions and denies suicidal ideations. There's no also hallucination reported. The patient is oriented to time, the person and place. However, he or she is confused about the date. And then the patient's insight is limited. However, he or she can judge fairly. So this is just an example of a narrative report or in a narrative style of documentation on your MSE or mental status examination. So in summary, understanding the nervous system and conducting a proper mental status examination are essential skills for nurses. So they help us, or the nurse this helps us identify any abnormalities of your patient. It provides accurate care kasi once we know the problem or abnormality of the patient, then we can now focus on that and give appropriate nursing intervention. We can support the patients with neurological and psychiatric conditions. Okay? So thank you for watching this video. If you have questions, clarifications with the things that I have discussed in this video, do not hesitate to comment down below so that I can read and answer your questions if I have time. So thank you once again and have a wonderful day.